Hello, ma'am. Good evening.
Good evening, Dr. Denzi.
Yes, good evening, ma'am. How are you?
Good. I hope everything is fine with your
Yes.
on your side.
Okay. Could you try sharing your slide, ma'am?
Sure.
Yeah. Okay. I think we'll just leave it there for a while. Okay. Can you try changing your slides, ma'am? Just to see if there's a lag.
Yeah.
All right. Okay. So, ma'am, how's everything else? How are you carrying on with the sessions in the college?
We are having actually physical college. We are going to the college, whereas we have the interns and postgraduates who are posted for COVID duty as well. And third years and final years, we are doing online teaching, both for theory and practicals.
Okay. So, you're not affiliated to the university, I mean, the medical hospitals there, ma'am? Or
we have a campus. We have in the same campus we have a medical hospital, which has a COVID bed facility. So they are posted right now there. So
okay.
And we also are in kind of maybe in rotation. We may be posted there right now. They started with oral surgery department, and other department faculty may be also posted as per requirement.
Yeah, same here, ma'am. Like we're also having the rotation postings here. Accordingly, interns are posted for the COVID duties along with the PGs as well. So it's working around that way.
Yeah, I think it's more or less the same everywhere.
Yes. I think it's still going to take some time for the situation to improve because right now we've just not yet reached that level where incoming cases, and have reached probably a plateau in that sense. So I think, it's going to be tough for a couple of days. And we've been hearing Gujarat, a lot of cases. Same in the case here, Bangalore, Karnataka, everywhere else. So I think it's going to take time. In fact, yesterday I was watching an interview by Dr. Devi Shetty. So he had come up with some recommendations for, and recently appointed task force for COVID that regarding the oxygen crisis and everything. So he was actually stressing on a very valid point that in the end, the mortality and the morbidity will come down only when we have more doctors and nurses to treat the patients. And infrastructural facilities can be beefed up with the will of the government, definitely, when they pump in. But then vaccination aggressively needs to reach at least about 70% of the population for any sense of herd immunity to develop. Keeping that in mind, I think by far we've just reached about 2.5-3% only who've received both the doses. So I think vaccination in itself is the the only solution. And meanwhile, to manage with the distress and the cases of oxygen and nebulization and essential care which is required, I think more than the beds in the ICUs, he's also requested a lot of doctors who've completed their MBBS and waiting for the entrance examinations. So they've be deputed for this purpose. So let's just see how it goes, ma'am.
Yeah, I think they have even spoken about incentivization of with respect to the students who are taking part in these activities, especially at the time of crisis.
True. In fact, it's been suggested that if they could render the services in the COVID ICU, probably they could get like 15 or 20% grace marks in the NEET examinations. So let's just see.
Maybe some extra credits. Yeah, definitely some extra credits for people who are doing good humanitarian work.
So I think COVID has taught us more public health than any of us could probably teach in
Yes, I
life.
do. Yes.
So that's the
Now we
bright
have
side of
got
it.
for any lecture or didactics, we've got a ready example. Like we say, we can easily relate. See now, what is the situation kind? So it becomes like a very easy to use analogy.
Correct. Yes, absolutely. So things what we've read in the books and everything is now become layman terms, and vaccination, immunization, and herd
Yeah,
immunity,
yeah, yeah, yeah.
all of that.
So it's
So
like hands-on, like everyone.
hmm, okay. So I think we are just it's about 6 o'clock right away. We'll have participants joining in, ma'am. I think
No problem.
you're
We
okay.
can,
I think
yeah, we can
a
wait.
couple
We
of
can
minutes,
wait.
no?
Yes.
Yeah, I'm just putting this. It's also there on YouTube right now. So I've just streamed the link and shared it, so people can watch there as well.
Yes.
Okay, so just to give you a hindsight into this Rendezvous series is basically designed in order to talk and engage in conversation with people from our specialty, and in some cases even beyond a specialty. Now, the whole idea of the Rendezvous series is to give that a little bit of added perspective to students, because once they hear from anecdotal experiences and uh, various methods and rather methodologies which have been tried by various teachers and practitioners. All of
Mm.
this is to expand the horizon of public health dentistry as we know it, that it is not completely explored. A lot of that remains in the theory or in the conceptual way of reading them for an examination point of view. But then beyond that, there's a lot of practical aspects to it as well. Like we do tell a lot in terms of public health industry or dental public health, having a lot of scope and opportunities and all of that. But then we need a lot of essential direction. In fact, most of our postgraduates, they have repeatedly, asked a lot of queries and related to that. What do we do next, and how do we channelize? Like, if you want to be a good teacher, how do you take this up? Like, for the previous generation, I think. I would still, I mean, you happen to be somewhere in between. You are a professor in a dental college in Gujarat. So you would be able to give us a lot of insight into how was the scenario when you stepped into the world of dental public health, and then how you discovered through your experiences and through your journey, and how the development of the specialty itself has evolved over a period of time by various forces. For example, there was a phase in time where public health dentistry was sought after as by all the top rankers. Probably you'd be familiar with that, and people opted because we they used to get jobs, and that was also supposed to be coming to an end at some point of time. Like everything will extinguish after a certain period of time. So there was a momentum which drove the specialty. Probably much before that, it was an exploratory phase. So the closest analogy, what I would probably would like to suggest, is the discovery of fluoride. Like there's a certain epidemiological phase and a certain
Mm.
exploratory phase and post discovery and all of that. So if you look at our specialty, something which started off a little late, the initial years, and I had the pleasure of talking to various seniors in our specialty. They did tell me that there was an accentuated growth in the initial years of the specialty across the country, and then with the advent of so many opening up of so many private dental colleges across the country post the liberalization in 91 92 also made way for a lot of this. And there was some work in relation to the oral health policy, which of course still hasn't been implemented, rather, in principle, just as a pilot program. But there is some significant process happening. So our contribution in this context of time. So what we're looking forward is what can be done at this point of time, at this conjuncture, with the expertise and knowledge in dental public health. How do we position ourselves in this whole realm? And we'd like to hear from you about all this. And that's the reason why we decided to invite you for the series and for the session, so that you'll be able to give us light in a different perspective. So that's the whole background to the session.
Thank you so much, Dr. Renzi, for briefing uh, this. And I think I'll be able to lucidly share whatever you are expecting out of me, and which can be of benefit and to especially the young budding public health dentists.
Sure, ma'am. Okay, then. I think we can start off with the presentation, ma'am, since most of them are watching
Sure.
it on YouTube. I think we'll be having a quick run through for all the participants. Just want to tell that ma'am would be sharing her experiences of exploring various tenets of public health dentistry by means of how we fit into clinical practice and the idea of podcasts, which is pretty interesting, and we are all very eager to hear about that. And how do we actually practice public health in the 21st century? That is the multiple facets of dental public health. And she would be sharing her experiences through various anecdotal situations and her community outreach program experiences and so on and so forth. So I'd like to pass it on to Dr. Ramya ma'am for the presentation so that we can quickly come back, and I think by the end of that we can have a Q&A session. Yeah.
A very good evening to one and all. And at the outset, I would like to thank Dr. Denzi for inviting me to this show. And he has briefed about the the purpose of this particular program, and I really appreciate that he's taking a lot of efforts to promote public health dentistry as a specialty. To it is very important that the the core subject that is very important today, as we see public health is important, and we all suddenly had a realization how important public health is. And definitely public health industry needs a kind of reawakening, and that's the reason I really appreciate Dr. Denzi for all the efforts that he's taking through his Rendezvous series, and as well as the academic series that he has been conducting. To introduce myself, I'm Dr. Ramya Iyer, and I'm working as Professor Public Health Dentistry, KMSHA Dental College and Hospital in Sumandi Vidyapeeth in Baroda in Gujarat. So the other way I would like to introduce myself is that number one is that I'm one among you. And number two is that, as the picture says on this slide, that I'm a dreamer. So I have big dreams and small dreams, and I'm always in the pursuit of my dreams. So I'm a person who kind of goes on and trying to knock every door, and the door that opens, I consider it's my door. So I'm very exploratory in nature. This is what introduction that I would like to give myself. In this presentation, I would like to share my experiences, the learnings, and the understandings that I have gained through the journey of, the professional journey, I would say, of in public health industry. So I'm very happy to share this with you. And as I'm going to talk about this journey, so everyone has a journey, right? And everyone's journey has a purpose. So we need to ourselves. In fact, I had to sculpt myself to achieve the purpose of your professional life. So we all are striving to achieve success through achieve success, or in fact the purpose of our lives. That's what I equate to success. Okay, by four different ways. One is by doing what you are great at, that is by doing your profession. And by profession, I mean that you are qualified with an educational degree or other qualifications that make you competent enough to perform a particular work without any supervision. And then you can also achieve the purpose of your life by doing something what you love. And the word we have is passion, like, right? That's the most commonly used. It's my passion. So everyone wants to pursue their passion. And also we need to achieve the purpose through by doing something what the world needs. And lastly, we also need to do at times be prepared to do what we are just paid for by acquiring certain set of skills, okay, or training. And it may not need certain educational qualification. So it may look very philosophical at the in the premise, like in the beginning, but actually it is very realistic. if you consider, let us say, let me talk about this profession and vocation. There is a difference between profession and vocation. So profession is something which you need to have education qualification for doing something. You are a public health dentist and you are going to do a work which is going to be in line with your qualification. And in vocation, maybe you are overqualified for that, but what you need to do is that you need to acquire certain set of skills and training. Okay, and profession and vocation are very important in every person's life, because that's for which you are paid for, right? So that's very important aspect. So the most beautiful aspect of this model is that at any point of time, we don't have all this working for us at the same time. Like we don't have in most of our lives, a profession, vocation, the mission and passion do not happen at the same time to us. Okay, and so we must be prepared to take this one by one, or as it comes to us, and then slowly step on to the other. If you ask because I need to talk about my journey in this, like I would say that before even I got a firm footing on the profession, um, I had also worked for purely on vocation basis. Like I had worked in a call center or KPO, or like it's a knowledge processing outsourcing unit of a pharmaceutical company. Okay, where they didn't bother what I am, leave alone dentist. You could be anybody. But then what you need to have is a certain skill set, like whether you are able to have good language skills, and you're able to talk good to the customers, and then whether your voice modulations, your voice training. Okay, all these were important. I went through that phase when at the time when my profession, you didn't have a firm footing on my profession, and I was getting paid for that, right? So it's like but the most beautiful aspect is that the amount of efforts that I had put on my vocation at that point of time is paying off now, when I'm actually pursuing my passion in podcasting, wherein audio and how you modulate your voice, all these things have probably come a little easier to me by virtue of my efforts that I have put on the vocation side. So this is it. Like sometimes we may not be in a position to pursue your passion, but then you need to step onto something. So you need to step onto profession, and then see if you can kind of connect with your passion. And you need to sometimes get onto your passion and see if you can connect onto your profession, mission, or vocation. So the most beautiful aspect is that when you are trying to see the achieve the purpose of your life, for all these things, all profession, vocation, mission, and passion do not happen at the same point of time. But another beautiful point is that you can always boost your passion by profession, or your vocation with passion. Your passion can boost your mission, and your mission can boost your profession. So these are all kind of interconnected. So I want everyone, like especially the young budding public health dentists, to know that we need to be prepared. Unless we are prepared in this particular way, we will not be able to understand that we can have multiple facets, and we may not have it at the same point of time. So don't get stuck. So you don't have the stereotype that I need to be doing this at this point of time. So this is a stereotype that we need to break. So you will be there at some time or the other, and it's just a matter of time, and it's going to work for you. And then talking about actually my journey as a public health dentist. So this is my photograph on convocation day. And so in fact, I would say that this the entire photograph and the attire, and especially the hat, reminds me now, or it kind of an indicative to me now, of the various hats a public health dentist is supposed to be wearing through his life. So maybe we may be kind of wearing different types of hats, multiple hats that we may need to wear in the future. So this is a kind of message that I get whenever I see this photograph. That's the reason I put this photograph here. And after post-graduation is a time, usually, it's a time of contemplation. So that's a time when we try to contemplate what our, what we are going to be just trying to discover. And it's a phase of self-discovery. So you can say that, there's various avenues are there for being, being a public, after qualifying as a public health dentist. Okay, so there's so many avenues are there. So here, I put on a few things, like it's not going to be only one. You can be, it's, discovering what we can be is, I would like to even rephrase that, discovering what discovering what all we can be, maybe like that. So we can be multiple facets can be worn by one single person. We can be a public health dentist in academics. At the same time, we can be into journal publishing and editor. We have public health dentists who are journal publishers and editors. There are public health dentists who have independent practice, tobacco de-addiction and centers, and they're specialists. And we are having public health dentists who are researchers, epidemiologists who are working in public health research institutes. And there are public health dentists who are working as, who are biostatistics and research consultants. And there are public health dentists who are policy and program planners in association with the government, and also as clinical researchers in pharmaceutical companies. And in fact, I'm very sure there are many more avenues to this. So whatever avenues that we are going to, choose, or we are going to venture into, like, it's when the doors will not open. So unless you have the password. So the password, is basically when you have a password to any particular account, it's alphanumeric in nature and all that. So the password to, to get into any particular avenues, that one or more avenues in public health industry, would be like the right mix of knowledge, skills, and attitudes. Like it's like an alphanumeric. So you need to have the right mix of knowledge, skills, and attitudes, and then your door opens. So that's how every door opens for the various avenues that I'm presenting here. So talking about me, so far, I have explored or discovered as of now myself as a public health dentist, as an academician, and then a social media content creator and anchor with respect to my podcasting, and also as a dental practitioner. So of all the three that discoveries or explorations I have made myself as a public health dentist, so I would like to first talk about me as a kind of dental practitioner first. Okay, this is the most recent venture I have been into, and it's very exciting. And apart from that, why I'm going to talk about this first is that I always realize that public health dentists are the best candidates for clinical practice. And that's because sometimes we have students who have these questions: if at all I had to do clinical practice only, and then why did I do public health dentistry at the first place? I would have been a BDS, or I would have done any other other specialty branches which are more skill oriented, probably be more rewarding in clinical practice. That is because we have not actually realized, or we are often overlooking, that the soft skills and other important skills that our specialty has endowed upon us, and we don't realize that, because you see that who other than a public health dentist can be a good communicator. We have been doing health communication, and it's a competency, and by virtue of our training and qualification, we are very effective communicators. We know the knowledge levels of the people. We know what the people want. We have been giving credible information, and we know the technique of delivering the information. So we are inherently effective communicators. And that's a reason, like, I would kind of encourage the present generation people that dental public health dentists are going to be very excellent clinical practitioners, because they are very effective communicators. Secondly, because we are incredible influencers. and we are influencing communities, right? And so influencing an individual patient should not be a great task. So we are actually being incredible influencers, and we need to unleash the power of persuasion that we possess. And third, and we are actually teaching dental entrepreneurship, and we're also teaching dental practice management in even to the undergraduate students. We are teaching this. I think it's a part of the curriculum. Which other branch teaches dental practice management in their curriculum? So so that means that we are actually, kind of, as of now, we have not explored, probably the potential benefits our specialty or the curriculum itself has given on to us, right? And and that's the reason that probably we think that, we are not actually, probably we shouldn't be doing clinical practice. No, please let us come out of that inhibitions. In fact, we should realize that our specialty has made us more suitable for clinical practice. And by virtue of whether we have what do you say, comprehensive clinic or not, or we are always in touch with the, at least the basic clinical skills. And even in the outreach program, or in the peripheral center clinics, or in the comprehensive clinic that is running in the departments of public health dentistry across India. So we are very teachable, and it's very easy for anyone. We can be easily trained, and we are teachable. For one other reason, apart from that, we have the basic clinical skills, is that we don't have that mental block like a prosthodontist who would say that, no, I don't do root canals treatments, or an endodontist would say that I won't be doing complete dentures, or we don't have such kind of mental blocks. We can be trained for everything, and we are extremely teachable. So this is in general, and we have specific skill sets. And so far, for people who are asking what is our exclusive skill set for doing clinical practice, so first is preventive dentistry. And this is one of the most unexplored or untouched upon areas by most of the dental practitioners, even the specialists. They don't do, they don't much focus much on this area. And I would give, like I had, we can definitely convince the patient. Like many people say, who would, people are not interested to get preventive treatments. It's a myth, because it's like, I have been in the infancy of my practice, I should admit. And last week, I had a patient who had, class 5 restoration, composite restorations, and, 6 of his teeth. And he said he had, sensitivity in all those 6 teeth. And he, in fact, insisted, he told me that I needed to remove the composite and do a refilling, right? So then I just examined the patient, and then I found that the composites were intact, and there was a marginal integrity was good. There was no chipping off of the restoration, nothing was there. And then he had, but he had sensitivity. Then he was 54-year-old. So I just told him, sir, you wouldn't be requiring a re-restoration, but then you would, we can go for, fluoride varnish along with a remineralizing component to it. So it would, kind of help you. And you would, I know the patient was convinced. Yes, I convinced this patient. He is going to get this treatment done. He was very happy that I told him we're going to have 2 sittings. One, I told him this is how we are going to proceed. This is very minimally invasive. His patients are willing today for getting preventive treatments, and this is the truth. So let us be, let us be very positive. And this is a time when we can say that probably the right time for you guys to actually, use all your public health and preventive dentistry concepts onto the people, because people are more receptive now. They're able to understand the concept of prevention now. So this is where this I wanted to very emphasize to the present budding dentists. And also we have tobacco cessation counseling and interventions. We have risk assessment that can be used or integrated in our practice. Patient oral health education, I don't think anybody can beat us in that. So I think a little bit, this we have to. The thing is, like, we have to feel that being a public health dentist is actually an asset to be, kind of adding to my clinical practice. So that we have to instill this in our mind. And this is a kind of a collage that I have put here. So as I said, whatever we do, we need to get that extra bit of training that is required in whatever field that we do, and whether it be root canal treatments or whether it be tobacco cessation. By God's grace, I was fortunate enough to get trained in the best of the resource centers, whether be it for tobacco cessation or for other specialty trainings. So, and then you can see that this is a wall on my clinic, and I'm very, very explicit, and it looks like a typical public health dentist clinical practice. I probably put TCC center here. You would not find this idea. Does the Tobacco Intervention Initiative, which is run by the IDA. So we have a lot of people running this, attending these courses. And you would probably find a very few people putting these boards explicitly, because so but I, as a public health dentist, I felt like I am a public health dentist. I'm confident enough to do this, and I'm going to tell my patients proudly I offer these services. So we have to say that what we stand for. Unless we say what we stand for, you would never get that kind of importance that we need from the patients or the society at large. So we need to be very, very sure about ourselves. That's very important. And then to the journey of myself as a public health dentist in an academic institution. So you can see that I have put here, and it's very, they say academic institutions, for me it's an amazing experience, because it's there is a maze in it, because there is a maze. So that's the reason it's amazing. So it's very interesting. At the same time, it's very, very laborious. And if there is this model I just put, and I wanted to keep it light. Dr. Denzi had said we do not, to kind of keep it very light. So I just put very, very minimum model and theories over here. So it's just to say that the faculty roles, competencies, and basic knowledge and skills and personal characteristics, you can see that we rulayega kya aur kya karna hai. So this kind of feeling would come. But then I see that it's a very, very responsible work that we do, because we are building up the next generation. That's the reason probably this is, if you are a person that you want to be in teaching, and you are feeling you have that responsibility, and you are ready to take the responsibility of building the new generation and going to upgrade yourself with all the competences, and academic life is going to be something which is going to be very rewarding for you. And so a lot of things, as I said, this model has been proposed in the year 2000, published in the year 2006, and now it's 2021. And you can just think what all changes and what all expansion in our faculty roles has happened in this this many long years. And so thanks to the accreditation bodies, and from the change, there's been a change from perish, publish or perish. There was a quote, that was a phrase that was used previously. Now we are into, either if you don't innovate, then you will be falling into the inferno of stagnation. So like they say, you should, the greatest inferno, the hell, is the stagnation. So you should never be into stagnation. And I'm very happy to be in an institute which promotes a very good research and innovation ecosystem. And I've been able to sail through successfully from publications to slowly to taking small steps towards innovation and ecosystem. And with respect to our dental public health or public health dentistry specific competency or work or role, as a instructor or a teacher, it's now I have modified myself in my journey. You can say that there has been a lot of difference in how I was as a team in charge in outreach camp, and just by supervising or doing it or inspecting and doing it myself or something like that, to now I'm a team charger, because the present generation needs to kind of a lot of, they're very enthusiastic and they need to be charged because it definitely So this is the one kind of I just wanted to share with you people. Like it's a kind of transformation which has happened onto me because I'm basically a very a serious as a teacher, but then I have academics or something. Everything has changed a lot over the time, and unless you are going to be having a student friendly attitude and be one among them, and it's and make the kind of work more enjoyable for the students. It is going to affect the camp outcome or outreach program outcomes as well. So these are the small changes I have seen as thing. And this is like classroom teaching learning. So I just wanted to show the difference between authoritarian approach and student-centric approach, but nevertheless, I look equally aggressive in both the photographs, actually. So the photograph on the left side is actually, I can see it through the body language. I like the students to focus on the body language of the teacher and the student here. Okay, so very authoritarian approach actually. Now students actually want more demonstrative and more participative and approaches. Like this is a role play that we did for the faculty did together for this child abuse, to show or depict child abuse. So this is a kind of course we are trained in doing all these things, but this is more student centric approach. Everything is changing, and I'm happy that I am in a path of changing for good, even in these aspects. And coming to the online teaching methods, everything has changed. So in the last 2 years, you can say that everything has changed, and it's more of digital mode of teaching, and learning ways of students are kind of based on that. We need to cater even to the online. So some are visual learners, and some are auditory learners. Some students are learn by reading or writing, and some by doing this, especially the skill part kinesthetic. So we have been, because as teacher, like everyone, like I can talk for myself, like I have been doing PPTs. It's a way we have been doing lectures for years. So the easiest way is to go from the I prepare a slide and present, but then we need to give a voiceover now. Then we had started with slide casts, and then we said we focus on reading and writing aspect. We give some resource materials to them, and they will post it on the Google Classroom. And we'll then we thought we'll engage the students through game. We started with Kahoot, and many things were done in this. So many things have happened in this last 2 years, you can say. And in all serendipity, like I landed up doing podcasting. So I should say that podcasting is like I initially did not do podcasting or intend to do podcasting for teaching learning methodologies. It was 2 years back. We had this public health dentistry day. So on that day, like we had to do something. So what I did was, like, I had composed some lyrics, and it's like and it's in Hindi, and some jingle sort of thing, compose the music as well. And then it was supposed to be broadcast on the FM radio Mirchi of Baroda. So, but then due to some reason, it didn't work out. And I was not the one who would accept it. Nahi hua. So I said, why should you waste your thing? So मैंने तभी सोचा कि okay, I'll go and I will put it on. I publish as a podcast. So that was my first podcast. In fact, my first podcast is a song. It is called "Hum Hai Public Health Dentist." So this is the this is the first podcast that I've made. Then I listened to that podcast, and I actually over and over. Then I really felt like I was falling in love with it, and I somehow felt like that's it. It's this is what I wanted to do. So then it's like finding your soulmate sort of thing. So then I started using this podcast. I wanted to use this with a kind of an intent to kind of show or project what public health dentistry is, and who a public health dentist is. So this is one way I wanted to show. And then I also use this as teaching. Yes, definitely, as a lot of concepts I had done on teaching teaching methodology as a method, and for reaching to a wider student population. Yes, I did that. And then kind of this podcast also gave me this was a time when actually I met my passion. So gave a lot of scope for my imagination. So I was basically I liked storytelling, creative writing, and I just did all these things. I incorporated all the things I ever wanted to do in my life in that. So I got that scope to do it on my podcast. So this was it. So when it all happened, jab they met. So this was the story, and I made these are the popular podcasts that I have made, and I'm every podcast I can say has a story, and I love it every time because it's my passion. So before so I've gone. This is my story in brief. In fact, it's been my, I don't know whether I have anything remarkable in my journey, but yes, I've always felt like everything I do is, it's something I always felt I'm a beginner, and every day I do something because I learn something new. So uh, to all the budding public health dentists, I should say that you've got what it takes, and I'm just believe me, you can have it all. And but the thing is, you need to have a lot of patience because you just can't have it all at once. So it takes a little bit time. So given some time, so then everything will fall in place. And I extend my gratitude to my family and the Institute KM Dental College and Hospital, Sumandi Vidyapit Baroda, the department I belong to, and then my senior faculty members of the specialty across India, and my colleagues and my peers and seniors who are also an Indian Association of Public Health Dentistry, all who have been kind of a great support to me all through this journey so far. With this, I end my short, brief journey. Thank you so much.
All right. So that was really, really splendid, ma'am. I think what Dr. Ramya shared right from her orientation, into exploring various aspects of public health dentistry, it's really commendable how you have actually given yourself a choice without any bias to explore various tenets of the subject. For example, I think something which you've started with the podcast recently has been really amazing because that's as we notice that it has given a new way of how we reinvent things and put things forward. In fact, for public health dentistry, various areas have to be completely explored and fulfilled, lying in terms of the outcomes of what we desire to achieve one day. That is eradication, or at least control of dental diseases across the world. And that's a really splendid journey, ma'am. And I should say, I think we have a lot of people who've joined in between and who've watched it in parts. So I think quickly I just open up it for discussion. Okay, good evening. Hiramat sir is with us right from the beginning. Good evening, Hiramat sir. Good evening, Vikrant sir is also here. If you could chip in. And we also have a couple of postgraduates and undergraduates as well. So yes, Dr. Hiramat sir, your opening remarks.
Good evening, everybody. Thank you very much for everything. And at the very outset, I would like to congratulate Dr. Ramya Iyer. She really presented very well. It was very interesting. I should say the journey for her to come and sit in the public health dentistry area. And of course, she said many points of her versions and her interest of the things. And as you said in the end, that coding was one of the things that she wanted to experiment, and it was very useful for in many ways. I really know that as a public health dentist, she opened up the different kind of chapters, different kind of areas where one can have an interest and can pursue it. And what I liked the most was she said the public health dentist can be a very good clinical practitioner, wherein we have a excellent skill of communication or convincing or dealing with their attitude and the social behaviors. it's a major part in that way. So thank you very much, Dr. Denji, for providing such kind of platform for continuously it's going on. Thank you so much. Thank you, Dr. Ramya.
Thank you, sir. Thank you for your words of appreciation and, in fact, your guidance and your always support and motivation has always helped me. And I know a lot of people in this specialty, to do what they can potentially do. So I really look forward to all your support in future endeavors as well, sir.
No, it is there, Ramya, but it was a question of your interest, your commitment, and thing has been taken in a way, and you have gone in that particular journey. And I'm sure that you're going to reach still higher up. Wishing you all the best, and I'm happy the way the things are going on with you. Take care.
Thank you. Thanks a lot.
Thank you, sir. Thank you so much for pitching in your inputs there, sir. And we really like what Ramya is doing is she's not doing things very new or different, but she's doing things in a very different fashion, I think, which would really relate. Yes, before we can have some more questions, Ramya ma'am, now I have a couple of questions, which we've collected from our participants previously also. Now, when it comes to challenges in teaching and learning, like someone who you've witnessed a professional over the last 8 or 10 years now, post your post-graduation, what was the immediate challenges, like from being in post-graduation, like we become teachers default, so it takes us time. So how was your experiences and what were your challenges in the initial years of how do you translate what you have read and what you have understood in putting it across to students? Because there is a lot of disconnect, as we clearly agree that students don't understand the principles or the topic or the concepts. So what were your initial challenges in this regard?
Okay, I think what I understood from your question is what are the challenges that we faced in after your post-graduation when we met the students while we teach. Yes. So actually, I would say that the students today are totally different, and how we were as students, like that is totally different, kind of a different, let us say, era. And now today we are whatever it is, we are going to cater to the present day students. Okay, so the present day students actually are not liking long lectures. Number one. So, and we need to, even if the lecture session is for 45 minutes duration, let us say that, we need to actually have more interactive sessions. So that is the one thing, like, so conducting and to have their attention focused for a long period of time. That's one kind of a focus, one kind of a challenge that I felt. So we had to, kind of modify the way we are going. In fact, we were taught how to take class, that also basic, something like, you unlearn everything and you have to learn everything new. So it was something like that. So we had to, kind of, actually, it's not only I who does, like, it is a teaching methodology. It is a whole department or anyone who has to decide how to go about with it. So we, actually, at least we need to have certain things like, what we decided was recently, I can say that flipped classrooms we have done. And so, for example, the topics, let us say lectures on IDA and DCI. Okay, so these are the sessions where you actually get the least cooperation from the undergraduate students to, to handle these sessions. So what it was decided was that that classroom was converted, or class was converted into a debate session. So it was like IDA versus DCI in the, as a, which is a better professional body. Which is more important professional body, or which is in terms of its contributions, or that they have their place. They both have their different places in the profession, but still it was, like I said, debate. So we made teams, we divided the class into two, and then there are people who are telling why IDA is better and why DCI is better, and we really got different insights into all these topics, which we otherwise, sometimes it is very, very boring to something, for an undergraduate student to sit for a class of an IDA or a DCI. unless it is, it is, in fact, it should be self-learned. There are certain topics which need to be self-learned, but when we conduct it as a lecture, it can get boring. So the method is we have changed as a debate. So now I saw that, people, aggressively, there was a team which was aggressively professing for why IDA is better. So even in terms of they went to that level that, they had this many webinars have been conducted by the IDA, and this many webinars have been conducted by BCA. But I was so happy that the students are still going and looking into these webinars. So I thought probably this is more, kind of pushing them to learn better. So these are the challenges that we faced was that, this monotony, they don't like. They want something to be, they want change in everything. So that is one of the challenges, and that we encountered in a different way. So that's what. If you, I hope I answered your question. I don't know if you had anything else.
Nice. Yes, ma'am, absolutely. I think to break the monotony, like you said, condensing the size of the class duration and putting it forward in a rather much more appealing fashion, changing the format, like, the wonderful example of flipped classrooms. I think those could be really, very helpful points to take this forward and to discover this. So moving on to another question, ma'am, is we normally see a trend for preference for clinical specialties. I mean, quote unquote, I don't really believe in the classification that a certain subject is clinical and non-clinical. By far, everything in dentistry is clinical. The moment you touch a patient in third BDS, everything to your internship, the curriculum is designed in such a way that you can practice a basic level of dentistry after your BDS degree. The whole idea of specialization for dentistry is more on certain areas and certain kinds of treatments, and how we've seen the evolution from prosthetics to conservative dentistry and all the classical branches which have evolved. How do you put forward for undergraduate students, especially the house surgeons and interns, who are willing to give a thought to even consider public dentistry as a choice? Not to someone who's already inclined towards it, but to give it a fair chance. What do you think needs to be done to orient them to at least, the decision lies with them that whether they want to take up PG in the specialty or not. But how do we put it forward in a virtually appealing fashion so that they at least know? Because most of the undergraduates think public health dentistry begins with indices and ends with indices, right? So what needs to be done in that area, ma'am? Like, what are your thoughts on that?
I feel for these, actually, there are, again, every specialty has its own core philosophies and all those things, and we cannot deviate from our philosophy. But yes, we need to put forward the merits of our specialty in a way which is appealing to these students. Yes, so we are dealing with we are doing indices. We have been teaching them indices and everything. Yes, but probably, we can, as you say, like more clinical exposure, more real-time exposure to these communities can be a good choice. So they do camps, no matter that they don't. I'm not saying that they don't do camps. Like all the undergraduate students are doing camps. Okay, but then again, for them, again, it ends like it is like, the department which does camp. So there, it's so they have to broaden the horizon. So that's the way, like, probably they need to be taught, like, how to think like a public health dentist. So that's the reason. That is one of the things, like, even when you take a case history also, like, I just tell them, like, why do you ask the address? So, I just want to tell you, think like a public health dentist. So I give them certain example, like, so what all a public health dentist can do. So these are the things, like, it is not there in the curriculum as, as not very appealing to the undergraduate student, but we still have to work on. And I'm sure that there is a lot of curricular reforms which are coming up in our specialty also. And that will be probably, kind of revolutionizing, our specialty with respect to this, appealing factor to the students. I think Dr. Hiremat sir can probably throw more light on what we are working on, what this specialty is working related to the curricular reforms, actually.
Yes, ma'am. In fact, our association has taken the initiative to to make certain core curricular changes and to make it competency-based curriculum changes. So let's just hope that these two actually materialize and come into practice in terms of doing. Now, when it comes to the likability of our specialty, ma'am, I think you would second this opinion. A lot of your students in your years of teaching and learning, there's very rarely students who hate the subject per se, but a lot of them enjoy because they describe it as an enjoyable experience, mainly because there's a lot of field visits, there's a lot of fun, there's a lot of activities. So it sort of forms the base. In fact, if in terms of the number of hours allocated to us by the dental council, enormous amount of time, especially in internship, a period of 3 months, and everything starting from third year to final year, the number of clinical hours and everything. What according to you would be small changes which we could do in the clinical hours, because we could make the lectures interesting, read like the various methods you've suggested. In terms of the clinical postings, would you recommend a slight change in order to make them understand more of the community framework, probably like recording case histories in the field, or sort of connecting the dots so that they get the public health aspect of oral diseases, and why are we recording indices, or why are we doing a lot of curriculum, because students directly relate to what is done for the examination. Like in the end, prosthetics comes down to border molding for them in final year, or fabricating a CD, so they're able to connect, or looking for a class 2 or an anterior RCT opening when it comes to operative. So like that, what would you recommend in the clinical setup or clinical way? How do we teach students, and how do we make them understand the aspect of this?
Yes. So this is actually, a clinical aspect. We can actually, the two already we are having a scope to do that. One is like we can have a posting of the students in tobacco cessation centers in the department and in the institutes itself. That will again give a focus onto them, because they will feel it is a kind of an applied area. So whenever there is an applied area, the students will be always more interested. That is, one is the clinical hours we can always have, and definitely we can have marks also, even if in exams. Okay, suppose it is graded, then probably that could be at least, if not in the university, in the internal assessment marks as of now, until gross DCI doesn't bring about these changes. Until then, we can always do at our internal or institutional level. We can always do this, like tobacco cessation center visit, and how they're supposed to do it, and even the phagostrom scale use or dependence, how do they assess, and how they are going to choose the various options. So we can have a scenario based thing, like you have a patient like this, and how they are going to decide the management of this patient with tobacco addiction. So this is one way when they can always they will see some kind of an applicability. They will be definitely interested. Second is, these students are very interested in social media. Okay, so why not we divert or channelize their energy and enthusiasm onto that? Like we are asking them to make practicals for us also means that making a kind of even health education messages, how they are going to frame, or how they're going to design, or how they're going to write for content which they can prepare even for posting social media. So these all things probably would interest the students. So these need not be, in fact everything need not be prescribed by the DCI every time, but we can have a needs assessment at our institute or department level. We can have constant feedbacks from our own students, and in fact we can drive our interventions towards this based on their inputs as well. As of now, two things which drive them is something which is applicable, something they are able to apply this knowledge. They are not able to appreciate the indices because they are not feeling there is any applicability for them, unless they are going to do a post-graduation in public health dentistry, or going to be pursuing a MPH course or something like that. No, or going to do some epidemiology. They are not bothered about, so that doesn't interest them. So they don't see a direct applicability to their profession, so they're not interested in it. Is tobacco cessation is something, and definitely in most of the colleges it is with the Department of Public Health Dentistry. Whether it is a Department of Public Health Dentistry or not, still we can make a kind of we have 15 days posting. We can say that if 3 days you need to be posted at the TCC center and you need to do this work, right? So this will probably, kind of train them, and something which will, make them, better, and which can be used by them in their future clinical practice or elsewhere. So will be definitely interesting them. And second is something, it's like it's their pulse, like social media. So you can, kind of play with that. So that would probably improve.
Sure, ma'am. I think those are very, very valid suggestions. I think we should probably give it a try. In just that, so that we lay special emphasis on the applicability, like you rightly mentioned. When they are told the why of everything, then I think the what and where and all becomes fairly clear to them. So I think thank you so much for those inputs as well. Now let's just take some questions from the audience here. I think. Just have a look at the chat box. Dr. Archita, who's a first year postgraduate, she wants to do a course on tobacco cessation. Yeah. So how does yes, Archita, can you come online and ask a question? Like very.
Good evening, sir.
Yeah. Good evening. Good evening, Archita.
So actually, I'm a first year postgraduate and I wanted to do a course in tobacco cessation. So I wanted to know that in the current era, how should I apply for the course? Like, what do I need to do if I want to have my own tobacco cessation center in my clinic? Then what do I need to do for that? And how can I apply for that? And what training do I need?
Okay. There are various options which are there when you want to get trained in Nimhans, Bangalore gives a training, and then apart from that, Public Health Foundation of India, okay, they have different branches all over India. They also give training, and apart from that, we have the National Resource Center for Tobacco, especially and oral health. Especially there is a MAIDS New Delhi, which is also frequently coming up with a lot of courses, which are for suitable for even postgraduate students, and even IDA comes up with tobacco intervention initiatives. I think periodically they conduct this tobacco intervention initiative in which even you can enroll and you can get trained. And apart from that, there are so many other options which are available, but I think this will help you as to start with.
Okay, ma'am.
Yeah, I think that's a good way to start, Archita.
Yes,
where are you
ma'am.
located? Which part of the
Lucknow.
country?
Lucknow.
Lucknow. You're in Lucknow. All right, great. So thank you for that as well. Any other questions? I think it's the PGs for here. Akshita, Armugam, and there's Charumati. Anybody else would like to? If you have any specific questions, you can put in the chat box. Otherwise, I think I'll just go back to ma'am then. So Ramya ma'am, finally then in conclusion, like, if I have to put the context and I really like that one particular slide of yours, the maze and how you figure it out through, various harnessing various roles and responsibilities, specifically in terms of finding your way and accommodating that. So it's been a long journey, and you have discovered it at your own pace. So what's your suggestion for students, especially the postgraduates who who gather a lot of knowledge and information, and who finish their masters in or even if they're pursuing in their post graduation, what is the first thing that they need to do? Like, how do they find their own passions or interest areas in the subject per se? Like if somebody likes tobacco cessation or oral health education, and someone wants to be a social media developer, so where do they begin from? Like how do they do this? So what would be your take home message?
Yes. So I don't know. I shared my slide in which I showed a lot of, I showed a lot of hexagons. Okay. So I would say that, whatever you need to have a tree, or I made a hexagon, you can make a cloud. Okay. So maybe it's an indicative of something. Like you put, you can have your own kind of a diary or a logbook for yourself, and see what every day you can see what is your interest, where do you want to, like for Dr. Archita, she has come up, she wants to do, she has to have it, she has made up her mind to have a tobacco cessation center at her clinic. So it will be definitely like she is going to put it there. So it is like, it doesn't happen. It's not something like, it can just happen suddenly. I can say like, for me, it was, it can this just happened. So I just thought this is my, like, podcasting or something. Like I just thought, okay, this is good, I'm going to do this. But then you'll realize it at the right time. See, now again, as I said, I need to go back to that first slide and say that, you need to see whatever you get, you hold on to it. To today's persons, like, you don't wait, you don't wait or waste your time just because you are not getting you wanted to be this and you are not. So go to the next level, go to the next choice. So you need, and you can always come back to the ones which you always wanted to do. So that's the kind of advice that I would give. Even if you are going today, you are getting a role as a volunteer in a particular NGO, and you are going to take that particular role, because that is somewhere in your life going to help you in your profession. So it's like, they're all interconnected. So do not, think like this is the only way, this is the way, because you are not the planner, and I think the planner is somewhere. Uh, so I think we can only kind of accept our things, and we can move ahead. We can always say we can come back to it. So plus don't waste time. That's all. You just do whatever is on your way right now. Do not think that I'll wait for this. No, take this. Whatever comes your way, take it.
Thank you so much, ma'am. We have just one last question from Armagam. Yes, Armagam, go ahead. You wanted to ask ma'am a question? Yeah, go ahead. You can unmute yourself and ask. He had a question on an epidemiology related opportunity. I think he's come across something which he wants to ask. Go ahead, Armagam. We can hear you. He's not connected to his audio.
Can you read out that question, because I'm not able to see in the chat box?
Yes, Armagam, can you hear us? Okay, just give a bit. Okay, then I'd quickly like to propose a word of thanks to Dr. Ramya ma'am for doing this. Meanwhile, when you can connect with the rest of the students. Now, for all of us here, Dr. Ramya ma'am has been a senior in our specialty who's done things in a very hatke fashion, and that is what is really appealing to all of us, especially for me in my interactions with ma'am at the conferences and various other podiums. So she's someone who has explored various areas, and we wanted an provide a platform for this purpose, so that it can be related to some students, some someone who's willing to do something differently and to find out and actually throw light and give out the various opportunities. And like ma'am said, I think it's all up to you all guys. Like once you map out what you're good at, identify your strengths, your weaknesses, identify your key areas, and then pick up on these things and start working towards it. Okay. Now, unfortunately, we're all facing the COVID crisis, and a lot of us are locked up at homes and trying to understand. We don't really know how this is going to turn out, but then we really understand as students, you are facing through a lot of anxiety and apprehensions, and probably you're in the middle of your course and someone's in the first, second, third year post graduation. So there is a lot which you could do. You need to assimilate your base knowledge and build upon that, and then work on certain specific areas. Now, public health dentistry is by far the most fascinating specialty, because it leads you to an entire, let's say, an arena of doors which open into various fields. Like, we've had the fortune of ma'am sharing her expertise in some of the areas like tobacco cessation, or be it in social media content development, and her experience of podcasts, or even as being as a teacher, as an academician in the teaching scenario. So it does give you an opportunity to take this forward and identify and then work upon that in that direction. So thank you so much, Dr. Ramya ma'am, for doing this, for taking out time on the Sunday evening and sharing your experiences, and for making this happen. Like they say, we are here to share experiences and make sure that we are able to relate to it, and hopefully that it really resonates with students, and takes this, subject and specialty forward to its fullest potential. So thank you so much, ma'am, and thank you all who joined till the end as well. A special note of thanks to Dr. Hiramat sir, who's really been supportive and has helped in actually curating this Rendezvous series right from the beginning, and his support to PhD 101 for making all these things happen. And we hope to keep this vision forward in the upliftment of our subject and specialty, and take this forward to the fullest potential. So thank you so much. Thank you so much, Ramya ma'am, for
thank you so much, Dr. Denzi. And I should say that I'm here. I think I'm just whatever shared experiences I have, it's only a small kind of an addition to the big job that you are doing. So thanks to you for all the endeavors that you're taking. Thanks a lot.
Thank you so much. We'll see you all soon. Next session of Rendezvous, and we'll continue with the academic sessions as well. So all of you, stay home, stay safe, and stay connected. Goodbye, and see you all very soon. Thank you so much.
Bye.
Bye-bye.